Sambula Vinaka, and of course, welcome again to our our show, Oral Health and Overall Health. Thank you for joining us once more. And we know that we are learning quite a lot from the care of children, our immune system, and now we are coming to oral health and the elderly. No, we looked at the children. Sometimes the elderly, we don't do too much with them, but let's take time to have a look at the elderly and how to take care of their oral health. And of course, we welcome Dr. Numa with us, our guest panelist, and let's give him a moment to say something to you.
Mbula Vinaka, and thank you for watching this episode again. Now we are going into oral health and the elderly.
Our elderly population, their oral health impacts their overall well-being.
We are talking about this age group, 60 years plus.
60 and beyond.
Yes. Yeah. We call it the senior citizens.
Some don't want to be called that. It's good to be young, even though you're old, but you think young. Anyway, as people age, their dental needs also grow. Let's look at what aging does to the mouth and what families and communities can do to support their senior citizens. Okay, so in looking at our first segment here, what are some common oral issues in adults or in older adults, Doc?
Yeah, before we go into that, we can see in today's discussion, it will highlight a group that often struggles silently. Our elderly population, and how their oral health impacts their overall well-being. Yeah, and some common oral health challenges are silently faced by the elderlies: dry mouth, tooth loss, very significant, gum disease, denture problems, oral cancers, and many of these are worsened by medications or chronic illnesses. And medications. I heard that in some countries, when they reach this life stage, then they have lots and lots of packets of medications. Yeah, more than 3.
One little suitcase.
Yeah, all medications. And when they going to another country, and then one
carry the suitcase of medication.
And they always must be your medication are here. And then if you are not having your medication, then they said, like you are a bit off or abnormal that you are not getting your medication. But we should be like, we should be.
That's excess baggage.
Yeah. Okay.
Why do you have to carry a suitcase of medication? Because you're not well.
And then some of these medications, they're also contributing to dry mouth, because some of these medications, they've got certain percentage of alcohol and all this.
Yeah, and pain in the mouth may go unnoticed or unspoken by the elderly. They have the toothache, they just lie there quietly, they press against their mouth and they close their eyes and they just try and absorb it all. But, that pain, they silently suffer. Okay, so...
Very true.
Okay, so how do they suffer, Doc?
First of all, they suffer silently. Yeah. And...
why do they suffer silently? So they're isolated, eh?
Yes, because they're isolated. And sometimes shame or the belief that loss is normal. Yeah. Then when they lost a tooth, they think, this is part of my aging process. But we see that tooth loss amongst the senior citizens or at the elderly stage, we should be retaining natural teeth for a lifetime.
I was talking to you about my great-grandmother, my mother's grandmother. That old lady...
I just want to intervene. So your mother's grandmother. So when we were talking about your mother's grandmother, can you just relate, might be what era, what year?
Yes, Doc. Just looking back, I know in the 1960s, I used to go and visit my great-grandmother.
Wow.
This is my grandmother's grandmother. My mother's
grandmother.
My mother's grandmother, my mom's grandmother. And, you know, she was born in the 1800s, late 1800s. I think the 1880s,
right,
like that.
true.
Yeah, when I used to go up, she was already in her 70s, 80s. And she died at 96. She was age 96, but with all her teeth intact.
Oh, that's...
None of her tooth fell. She had all her teeth there.
32.
And yeah, the full set.
32
full set,
teeth,
yeah.
right.
A strong vegetarian, only eat from the garden. And she hardly ever eat anything that's boiled or she would put them in the bamboo, go and roast them. And she only ate food that's like the breadfruit, the vundi, bananas. Very healthy old lady, very clean old lady as well. You know, she showered. She also brushed her. That time they didn't have the proper toothbrush.
Yes,
She would cut.
cut of
No,
twigs,
we call it gavinilawe.
Oh,
She'd cut that one and soften the edge, and she would use that, and then pull it out and use it as floss to clean her tongue and clean in between the teeth. Very, very clean old lady. But the thing was, I remember about her was her set of teeth.
Wow.
All full set of teeth.
That's a real Bulla smile.
Yeah. So, you know, the tooth loss, we regard our old people, when you go and visit an old person, you probably think in your mind, oh, they won't have many teeth, or they would have a full set of false teeth, and so forth. But the link between oral health and general health in seniors, how does oral health affect their overall health, Doc?
Well, for just to go back to your story about your great-grandmother, and that's a powerful testimony of what diet does to our teeth, and to our overall health. And that's a very important lesson for us now, that we should try and eat more of natural foods.
Yeah, one thing also, Doc, I forgot to mention was she grows her own sugarcane garden.
And that's her toothbrushing.
And that's what she used.
Her chews and a toothbrush.
She chews that, and then she use it also to brush her teeth.
That's the natural way.
Yeah.
That's the
and
way.
At that age, she was chewing.
Still chewing
sugarcane.
And for us now, I don't know how many of us have chewed sugarcane.
You know, she doesn't use the knife to peel the thing. She actually cuts,
jaws,
and then she just
strong jaws and strong teeth.
Yeah.
And she chews strong foods.
Yeah.
Very good. Okay, how does oral health affect the overall health? Okay, if positive things are done, then positive outcomes. Yes. Well, poor oral health can make it difficult to eat, speak, chew, or even smile. Those are products of poor oral health. It may lead to malnutrition, social withdrawal, and worsen existing conditions. Worsen existing conditions like diabetes or heart disease.
So if we are diabetic, this can make it worse.
Make it worse because they are going to eat more of these soft foods. And,
true. So dental care is essential for dignity and longevity.
That's very important. This word dignity. We want people to grow up with dignity. And that includes having natural teeth for life. People growing up and then losing the teeth, that's not dignified.
Okay, so let's look at dentures and the care tips. Many older adults use dentures, false teeth. What tips can we offer?
Okay. One thing I want to stress that dentures will never replace natural teeth. So we Fijians, we should be having this vision or aim in life to have healthy teeth that last a lifetime. And never think that you are going to lose teeth and replace it by dentures, because it will never be the same as your God-given unique teeth. Okay, dentures.
Clean them daily.
If you have dentures, then dentures will need to be cleaned up daily. remove them at night.
Okay.
And get regular dental checkup to adjust the fittings or detect infections.
How can we tell that your denture is not fitting well? When you talk, air comes out.
Yes.
And your words sounds,
and your words like you lisping.
Yeah.
And then denture too moves, wobbles. Yeah.
When you're eating, it moves. Sometimes it comes out.
It goes with the food.
Chew on it. Yeah. Okay.
So the problem is still there.
What if they have difficulty in brushing?
Okay. Due to stroke, or some of the inabilities. So that's where we need caregivers. Caregivers can help and use, some people in some countries, they use electric toothbrushes, mouth rinses when brushing, when it's difficult.
Okay.
Yeah,
Proverbs 16:31. What does it
Gray hair is a crown of
splendor.
Let's treat that crown with honor.
True, yeah.
Okay, I just want to give you an insight into one lady. She told me that she was being assigned to go and look after a lady. And she was just said, okay, you're going to look after her for 3 to 4 weeks at the most. And then she will
be gone.
Gone, pass on. Then you can come back to,
Right.
And then she went, and she told me her first assessment, she see the need. This lady, she needs a full mouth hygiene care. So that's what she does. She said, I clean her mouth, 5 bowls of water, I change, I clean, and then I brush, and after that she shows signs of life in her mouth by doing like that. And so, just a day, she starts talking, eating. Then this lady lives on for another 4 years with all her mental faculties and all her all back.
Normal. Okay.
And the people who know her relatives were very amazed at the transformation. See, that's where when the people have got difficulties in toothbrushing or in daily oral health habits or daily personal care, that's where caregivers come in.
Yeah. Amen. So for you senior citizens, gray hair is a crown of splendor.
Yes.
Let's treat that crown with honor. Okay. So our families and church support for the elderly. How can families and church support the oral health of our elderly?
Okay. Visit and talk about their needs. One of the things about these elderly is they are lonely. They're silent. So we need to visit and talk about their needs. Offer rides to dental appointments.
Take them there.
Take them for dental appointments. And churches can host dental screenings or create awareness during seniors programs.
Okay. Yeah, let's not forget elderly caregivers themselves, who may also need encouragement and guidance.
Yes.
Caregivers, those that look after the elderly.
Right. They need encouragement and guidance.
One good thing about us in the islands, we ourselves, we care for our elderlies. We keep them home and we look after them. Let's thank you for taking care of your senior elderlies at home.
Thank you.
You that is something, God's blessings is there.
Yes.
Your life will be long when you look after your parents or the elderlies at home. And you need encouragement. And we are encouraging you. Thank you so much for looking after your elderly at home. Take care of their oral health. And take care of their well-being, their health. And, they sometimes, make new clothes for them. Take them to the river to wash, or maybe to the
sightseeing,
and take them out for sightseeing, so that they can feel fresh and feel cherished. Okay, so let's reflect together. Oh, James 1:27, Doc, what does it say?
Pure religion is this, to visit widows in their distress.
Visit widows in their distress, okay. So there are a whole lot of old people out there, they feel distressed. Visit and offer encouragement. True. Okay, so let's just have a look at some of these, reflect on some of these questions. What oral issues have you seen among elderly relatives? tooth loss and discomfort. Have you seen that?
Tooth loss and denture discomfort. Yes, I've seen it. They've told me, and I even for one asked me to arrange for his denture. Then I arranged for his denture. Then he got his denture. And then when seeing him in church, then where's your denture? And he said, I'm not wearing. It's
painful.
Yeah, painful. And then I was thinking, well, it's just so that's why it's just good to make sure we have natural teeth for life. Eh?
Yeah. Okay. So
because those are the issues they go through: tooth loss, denture discomfort, difficulty in eating, difficulty in the might be foul breath, dry mouth due to medications. As we have said, some people, they must have their bags of medications. They don't know that those medications is again giving
sometimes
some.
Maybe they don't realize that there's bad breath coming out, because they haven't looked after their mouth.
Yes,
and so for us who go and visit, it's difficult for us to move closer to them because of that. So let's.
That's where we were saying caregivers play the role there. As I've said about that lady who does the cleaning up. She said it was foul, the breath was foul and everything, but then she makes sure she does her work assignment. Then she do that, then the big change.
Yeah, when they have dry mouth, we need to remember that could be due to medications.
Medications, because alcohol is a dehydrating agent, and some of these medications has got this alcohol component.
Alcohol elements in it.
Yes.
What might seniors avoid dental care?
Okay,
Why might they avoid?
Okay, some of them might avoid dental care, financial barrier or transportation barrier, and embarrassment or fear, and that they believe that tooth loss is part of their old age. So that's why some avoid dental care.
Yeah. Fiji has a very good social welfare system where the old people
now,
who are over 65,
70.
they receive assistance.
Yes.
Social welfare assistance. And financial or transportation barriers that should be minimized by now because they're receiving money monthly.
True.
And maybe for us relatives, if we have oldies at home, let's be mindful of that because they need that money to take them to services that they need.
Very true.
Sometimes we get that money and we use it in other areas, neglecting their needs like this.
Very true. And I'm thinking now for their benefits. They should invest too in their oral health. Buy them. I mean, for denture, there's no subsidy and going on, and then they should be having their so that to bring back that smile.
And they need to remember also, all of us, you and I, need to remember that that this belief that tooth loss in oldies is part of is natural with age. No, the story of my great-grandmother. No, that's not part of. Let's take good care of our mouth and keep our mouth healthy. Our teeth should be there. Tooth loss is a result of not choosing what you eat properly.
True.
Okay, what are gentle ways to support an older person's oral care, Doc?
Yeah, help with brushing or reminders, or reminding them, or provide soft toothbrush, mouthwash, and offer accompaniment them to the dentist.
Yeah, accompany them to the dentist for a dental visit. What oral signs might suggest a deeper health issue?
Okay, might be some mouth sores or pain, weight loss or trouble in eating, changes in speech or breath.
So once you notice that, folks, you know that those are signs
of a deeper health issue.
There's a deeper health issue. We've looked at different diseases, that connect to bad oral health. How can we, the community and the church, uphold oral health for seniors?
Okay, create a dental care fund. That's something we never think about it. Yeah, we should have created a dental care fund to cater for their oral care needs and also for their denture, denture fund. Okay, and host senior dental days. That's very important that we host a senior dental days. I remember some of these health fairs, especially America, and dental treatment is one of the treatment that the people come for. They usually have long lines for people needing. So I think we should create senior dental days, free of charge, and then train health teams for home visits. That's very important that we do home visits.
Have teams,
have teams in our communities.
Go for health visit.
Very
visit
true.
the elderly.
And then what your issues? We're going to talk about these issues.
Yeah. Okay, so just in the final minute, Doc, what does Psalms 92:14 say?
They will still bear fruit in old age. Our elders are vulnerable. Oral care allows them to speak, smile, and serve even in old age.
Yeah, their counsel, their stories,
Yes.
those are interesting, those are beneficial. Let's take note of them and take good care of their oral health.
True.
Okay, let's honor our elderly, not only with words, but with loving care, including their oral health. Yeah, okay. So to the elderly that are watching now, what's the message for them, Doc?
Knowing that your smile matters. I remember that Moses, he was 80 years old when God called him. And John the Revelator, he was a senior citizen when God still used him. When he was alone in the island of Patmos. Yeah.
Okay.
So to all the elderlies watching, know that your smile still matters and God still cares. And to the caregivers, may God bless your service.
Thank you for taking care of the elderly. Thank you for looking after your old parents there. And if you have oldies around you, take good care of them. Yeah, that is a blessing, because you will receive special blessings from God. And thank you again for who you are and how you're taking care of your oral health.
And mental health.
And mental health as well. Keep smiling, because that smile will tell others that you are happy.
And stay connected.
And join us in our next episode as we focus on oral health and mental health. Yeah. And until then, please keep smiling and stay connected. May God bless you. Samadhi.
Matmanda.